In this NPLEX Annex Farm Review, we'll cover vaccines. We'll focus on contraindications, precautions, minimum age required for the vaccine, and the possible drug interactions of the vaccines. The schedule of the vaccines for children is included at the end of this presentation. However, any current CDC vaccine schedule can be obtained from the CDC website. We will not focus on the number of the doses and all the ages when the vaccine is administered, because it can be easily reviewed from that chart. I believe that the board examination is more interested in major contraindications and whether the person of a given age should have had the vaccine, and that's why we're covering the minimum age for the vaccine. Prior to the lecture, test your existing knowledge about the vaccines. Quizzing yourself before the information is given can make the material more memorable. Pause the video and answer these questions, perhaps writing the answers on the paper. Which vaccines are contraindicated in pregnancy, and which are recommended in pregnancy? Which vaccine is contraindicated in those with intussusception, and which vaccines are recommended in people with asplenia? Which vaccines are contraindicated in people with egg allergy, and which ones are contraindicated in those with yeast allergy? Which vaccines are contraindicated in those with neomycin allergy, and which vaccine is contraindicated in those with history of thrombocytopenia? Which vaccines have an association with Guillain-Barré syndrome, and which vaccine is contraindicated in those with history of encephalopathy? Which vaccines are contraindicated in those with gelatin allergy, and which vaccines are recommended in immunocompromised patients? Of these two vaccines, which one is a better option for children and immunocompromised patients? And which contraindication is true for all the vaccines? Here we go. The contraindications that are true for all the vaccines are a previous allergic or anaphylactic reaction to the vaccine and a current severe illness with a fever. Any illness with a fever, not just the URI. There are 4 types of vaccines: live attenuated, inactivated, subunit, and toxoid. Combination vaccines are a mixture of subunit and toxoid, like the Tdap. Live attenuated and inactivated vaccines use whole microorganism. In live attenuated vaccines, a weakened virus or bacteria is used to make the vaccine. Therefore, it could cause the disease if the person is immunocompromised. As a general rule, live attenuated are contraindicated in immunocompromised and pregnant patients. Inactivated vaccines use a killed microorganism. They produce less of immune response than live attenuated and therefore require boosters. In subunit vaccines, a part of the microorganism is used, for example, a polysaccharide capsule of the pathogen. Sometimes a polysaccharide is conjugated to another protein, usually belongs to another pathogen. Those type of vaccines are called conjugated vaccines. Adjuvants are added to subunit vaccines to stimulate a stronger immune response in the body. The typical adjuvants are salts such as aluminum phosphate and aluminum hydroxide. Toxoid vaccines use a modified toxin produced by the microbe. The combination vaccines usually uses a toxoid combined with a subunit vaccine. Tdap or the DTaP uses subunit pertussis vaccine and the toxoid form from tetanus and diphtheria. The vaccines within each category are listed based on age. The youngest required age is at the top of the list. Rotavirus is an oral vaccine given at 6 weeks, but if the child is not vaccinated by 32 weeks, the vaccine is no longer given. Contraindications are severe combined immunodeficiency, colloquially known as bubble boy, and history of intussusception. Even the wild type of rotavirus infection can cause intussusception, not just the vaccine. Measles, mumps, and rubella are lumped into one vaccine. Sometimes varicella is added too. The CDC recommends that MMR and varicella vaccine for the first dose to be administered separately to reduce the risk of fever and febrile seizure, but the MMR-V combination vaccine can be administered for the second dose. The varicella and the MMR vaccine have the same contraindications, precautions, and drug interactions. The minimum age of administration of this vaccine is 12 months. The contraindications are allergy to gelatin, neomycin, and egg, as well as family history of seizures, thrombocytopenia, blood dyscrasias, and leukemia, as well as current active untreated TB. If patients receive a transfusion of blood, plasma, or immune globulins, vaccination with MMRV should be deferred by 3 months. Like all live attenuated vaccines, MMRV is contraindicated in pregnancy. Additionally, pregnancy should be avoided for 3 months after receiving vaccine due to rubella causing severe birth defects. Drug interactions, tuberculin testing, salicylates, and other drugs such as corticosteroids, immunosuppressive medication, and immune globulins. MMRV vaccines may result in temporary depression of tuberculin skin sensitivity. If the TB test needs to be done, patient can get it before the vaccine at the same time as the vaccine or wait at least 4 to 6 weeks after the vaccine. Salicylates increase the likelihood of getting the Rice syndrome with the MMRV vaccine. They should be avoided for 6 weeks after the vaccination. There are 3 flu vaccines on the market. One is live attenuated, another one is inactivated, and the third is subunit. Live attenuated one is administered through the nose. The minimum age for live attenuated flu vaccine is 2 years, and the vaccine is not approved for people over 50 years old. The contraindication is egg allergy. People who have had Guillain-Barré reaction to the past dose of the flu vaccine may react again, and it may also be a contraindication. Children with asthma are at an increased risk of wheezing after administration of this flu vaccine. Be careful with asthmatic children and children who are wheezing. Drug interactions. Antivirals may reduce effectiveness of the vaccine. Avoid these medications 48 hours before the vaccine or wait for 2 weeks after getting the vaccine to initiate the antivirals. There are 2 zoster vaccines on the market. One is live attenuated and another one is subunit. Both are given after age of 50. Live attenuated one, ZVL zoster vaccine live, is given sub-Q and its contraindications are gelatin and neomycin allergy. It is contraindicated for immunocompromised individuals. Those who have active untreated tuberculosis need to wait to receive the vaccine. Drug interactions. It is not recommended to administer live zoster vaccine with pneumonia polysaccharide vaccine, the one with 23 serotypes. Wait for 4 weeks between the vaccines. Pregnancy is another contraindication, so if the vaccine was administered, the waiting period before getting pregnant is 3 months. There may be a transmission of the virus from the vaccinated person to a susceptible close contact if the person who received the vaccine has a rash. Close contact should be avoided until the rash has resolved. Getting the vaccine will not treat primary varicella infection, chickenpox, nor will it treat the current zoster or current postherpetic neuralgia. Protection from zoster lowers after 5 years, but protection against postherpetic neuralgia is maintained much longer. Polio is another vaccine that has 2 different forms. However, the oral live attenuated is no longer given in the United States. Cholera vaccine is given to people traveling to cholera-affected areas. It should be administered minimum of 10 days before potential exposure. Vaccine reduces chances of severe diarrhea by 90% 10 days after vaccination and by 80% at least 3 months after vaccination. The only contraindications are in pregnant and immunocompromised individuals. On the CDC website, it was mentioned that if a pregnant person is traveling to the cholera-affected areas, the benefit of getting the vaccine may outweigh the risk of getting the disease, but there is not enough data to establish safety and efficacy. For the purposes of the NPLEX test, it is safe to think that all live attenuated vaccines are contraindicated for pregnant and immunocompromised patients. Drug interactions. Avoid systemic antibiotics and chloroquine. The presence of the vaccine can be found for up to 7 days in stool, so caution is needed with immunocompromised close contact. On our list, we have 3 inactivated vaccines: polio, influenza, and hepatitis A. This polio vaccine is injected either IM or sub-Q. Contraindications are in those who have severe allergy to 2-phenoxyethanol formaldehyde antibiotics such as neomycin, streptomycin, and polymyxin B. There is an association with Guillain-Barré syndrome, so caution is needed in those individuals. Safety and efficacy of the vaccine is unknown in pregnant people. The benefits of the vaccine may outweigh the risk of getting the disease, though. It is advised for immunocompromised patients to receive the IPV vaccine, inactivated polio vaccine. Inactivated influenza vaccine, IIV, is approved for ages 6 months and older and given intramuscularly. It is developed in chicken egg, so it's contraindicated in those with severe allergy to egg. Prior Guillain-Barré syndrome reaction will cause another reaction. Inactivated flu vaccine is recommended for pregnant and immunocompromised patients. However, immunocompromised individuals may not have a full immune response to the vaccine. It's considered category B in pregnancy, which means that there are animal studies done and showed no evidence of impaired fertility or harm done to the fetus. However, there is no adequate and well-controlled studies in pregnant patients. Unlike live-attenuated influenza vaccine, this vaccine does not have a contraindication of drug interactions of influenza antiviral therapy in the past 48 hours, and there's no issue with giving this vaccine to children with asthma and wheezing. Hepatitis A vaccine is another inactivated vaccine. It is approved for ages 12 months or older and is usually given 2 weeks before a potential known exposure, anticipating travel to a hepatitis A area. The contraindication is a severe allergy to neomycin. There have been reported cases where people have vasovagal response after getting the vaccine, so fall precaution is needed. It is pregnancy category C, so administer if absolutely indicated, and it is recommended in the immunocompromised. To understand efficacy of subunit vaccines, let's talk about the different types of vaccines that fall under the umbrella of this group. There are polysaccharide, conjugated, and recombinant vaccines. Polysaccharide vaccines are based on encapsulated bacteria. The capsule of the bacteria is made of this polysaccharide. Bacterial capsule helps the bacteria to evade the immune system, causing more severe disease in young children and immunocompromised patients, for example, those without a spleen. Now, to make the vaccine, the polysaccharide capsule is used as the antigen. However, it can potentially evade the immune system as well and not produce an adequate immune response. Such vaccines are not effective, and actually most are not used much. The examples of encapsulated bacteria are Haemophilus influenza B, Streptococcus pneumoniae, and Neisseria meningitidis. The conjugated vaccines overcome the obstacle of lowered immune response that the polysaccharide vaccines present. The conjugated vaccines use the polysaccharide from the encapsulated bacteria as the antigen, but it is conjugated to the protein of another pathogen. This conjugation makes the vaccine stronger, rendering the immunity in the person. Example of conjugated vaccine is H. influenza vaccine. Haemophilus influenza B is an encapsulated bacteria. The antigen is conjugated with tetanus toxoid protein. Streptococcus pneumoniae and Neisseria meningitidis are encapsulated bacteria. And for each bacteria, there are 2 types of vaccines, polysaccharide and a conjugated form. However, as mentioned earlier, the polysaccharide type is used sparingly due to a lower immune response. The recombinant vaccine is the 3rd type of the subunit vaccines. Its design is where a protein antigen from a pathogen is grown in a benign host. Yeast cell is often used as the benign host. It is helpful to know the source of the host cell in the recombinant vaccine or the protein in the conjugated vaccine in cases when a person is allergic to those components. Alright, hepatitis B and HPV vaccines are recombinant vaccines replicated in the yeast cells. H. influenza, pneumococcal, and meningococcal are conjugate vaccines. H. influenza is conjugated with tetanus toxoid, and pneumococcal and meningococcal are conjugated with diphtherial protein. Notice the abbreviation in pneumococcal vaccines. PCV stands for pneumococcal conjugated vaccine, and PPSV stands for pneumococcal polysaccharide vaccine. Likewise, in meningococcal vaccines, MCV for meningococcal conjugate vaccine, and MPSV stands for meningococcal polysaccharide vaccine. The host cells for other recombinant vaccines are here merely for trivial knowledge and are not high yield on the exam. Hepatitis B vaccine is given at birth. It is contraindicated in those with yeast allergy. An adverse effect is syncope. It can also cause apnea in some newborns. It is recommended to defer the vaccination if the newborn is under 2 kilos, but prematurity is not a contraindication. There are no adequate studies to evaluate the vaccine in pregnant patients. It is recommended in the immunocompromised patients. Some adverse reactions due to delayed hypersensitivity can cause arthralgia and arthritis, which is temporary. Other adverse reactions that have been reported are fever, dermatological reactions such as urticaria, erythema multiforme, ecchymosis, erythema nodosum. Autoimmune disease such as lupus, lupus-like syndrome, vasculitis, polyarteritis nodosa. Hib vaccine is protective against encapsulated bacteria, Haemophilus influenza B. This conjugated vaccine is given at 6 weeks through the end of the 4th year, and it's not approved for children over 5 years old. It is contraindicated for infants under 6 weeks and for those with anaphylactic reaction to tetanus toxoid. It can cause Guillain-Barré syndrome, and noted adverse effect is syncope. HPV vaccine is given to all genders starting at 9 years old. The contraindication is allergy to yeast, a vaccine component. Adverse reaction is vasovagal syncope. The older version of the vaccine, trade-named Gardasil, covered the HPV types number 6 and 11 that cause warts and those that cause cancer types 16 and 18. Gardasil 9, the newer version, covers 6, 11, 16, 18, as well as 31, 33, 45, 52, and 58. PVC-13 vaccine prevents the Streptococcus pneumonia infection and includes 13 serotypes. This pneumococcal vaccine is a conjugated vaccine and is a preferred type for children. It is given starting age of 6 weeks. It is recommended for immunocompromised patients, for example, those with asplenia, including sickle cell disease, people with HIV infection, cochlear implants, and patients with cerebrospinal fluid leaks. It is contraindicated in those with allergy to diphtheria toxoid. And apnea in some premature newborns have been reported. Drug interactions for PVC-13 is the prophylactic use of acetaminophen, which causes reduced antibody response to the vaccine. Using acetaminophen on as-needed basis is okay, but not the preemptive use of it. PPSV23 contains the purified capsular polysaccharide antigen from the 23 serotypes of the S. pneumoniae. It is also recommended for the immunocompromised patients, just like the conjugated form of this vaccine. The recommended age is 50 years old or older for those who are at increased risk for pneumococcal disease. Pneumococcal vaccines are not routinely recommended during pregnancy. Drug interactions are with concurrent administration of this vaccine and live attenuated vaccine for zoster. The vaccines should be separated by 4 weeks. When the pneumococcal vaccine is recommended for an individual, the conjugated vaccine should be given first. If the plain polysaccharide vaccine was given first, the conjugated vaccine should be administered 1 year after the polysaccharide vaccine. 2 of the meningococcal vaccines, MPSV4 and MCV4 vaccines, both protect against 4 serotypes of Neisseria meningitidis, A, C, Y, and W135. MPSV4 vaccine is a polysaccharide vaccine developed in the 70s and now is no longer used as a routine vaccination. MCV4 vaccine is developed in 2005. It is conjugated with diphtheria toxoid. There are 2 brands of the vaccine on the market, and they differ with the starting age. Menveo is approved for infants 2 months or older, and Menacta is for 9 months or older. Meningococcal vaccines are not routinely recommended during pregnancy. Contraindications are allergy to diphtheria toxoid. Adverse reactions are syncope and apnea in some premature infants. When injected 1 month after DTaP, there is a reduction of meningococcal antibody. Men-B vaccine is recommended for patients starting at 10 years who are at an increased risk for serogroup B meningococcal disease. This group of patients include immunocompromised patients, those with complement component deficiencies, asplenia, also recommended for microbiologists who are exposed to this bacteria, and anyone who is at an increased risk during an outbreak of serogroup B meningococcal disease. The usual recommended age is 10 to 25. Meningococcal vaccines are usually not recommended during pregnancy. Men-B vaccination should be deferred in pregnancy and lactation unless the patient is at an increased risk. RIV, recombinant influenza vaccine. It is approved for people over 18 years of age. It does not contain egg, therefore people with egg allergy may receive this vaccine. Like the other types of the flu vaccine we encountered, this one too needs caution with Guillain-Barré syndrome. RZV, recombinant zoster vaccine. reduces the risk of developing herpes zoster and postherpetic neuralgia in people over 50 years old. Drug interaction is with a concomitant injection of inactivated flu vaccine. We have encountered two zoster vaccines. One is live attenuated and this one a recombinant one. According to CDC, it is recommended to use the recombinant vaccine over the live attenuated one. None of the zoster vaccines treat primary varicella infection, current zoster, nor current post-herpetic neuralgia. If vaccinated, recombinant zoster vaccine has a better protection against post-herpetic neuralgia compared to the live attenuated one, according to UpToDate. The two toxoid vaccines we have on the list are tetanus and diphtheria. They are combined with the pertussis subunit one and given as a combination vaccine. DTaP is approved for children 6 weeks to 6 years. After 7 years old, Tdap is administered. The way I remember that DTaP is for younger children is the word pediatrics. D comes before T in the word. DTaP is contraindicated in those who developed encephalopathy within 7 days after pertussis-containing vaccine or currently have a progressive neurological disorder. The precautions with DTaP vaccine are history of fever over 105 degrees Fahrenheit with the previous vaccine, history of hypotonic hyporesponsive episode, or persistent inconsolable crying lasting more than 3 hours within 48 hours of receiving previous pertussis vaccine. Seizures within 3 days after previous pertussis-containing vaccine, and Guillain-Barré syndrome with the previous tetanus toxoid-containing vaccine. In infants with history of seizures, administering antipyretic concurrently with the consecutive doses of the vaccine may help with the seizures. Adverse reactions are apnea in some premature infants and syncope. Tdap is a booster immunization given for prophylactic wound management. The recommendation for a clean wound is to vaccinate again if the last tetanus was more than 10 years ago, and for a dirty wound to vaccinate if the tetanus was more than 5 years ago. However, if the person had less than 3 tetanus vaccinations in their lifetime, the vaccine would be administered for wound management regardless of the time lapse since the last vaccine. The 10 and the 5-year rule applies only if the person had at least 3 doses of the DTaP. The contraindications for Tdap are encephalopathy, including coma, decreased level of consciousness, prolonged seizures that occurred within 7 days of administration of previous pertussis-containing vaccine. Precautions need to be considered in those with repeat Guillain-Barré reaction. The vaccination needs to be deferred if a person has a progressive or unstable neurologic condition. People who had Arthur's-type hypersensitivity reaction following a prior dose of tetanus should not receive the vaccine unless at least 10 years have passed since the last dose. Also, caution is needed with vasovagal response to the injection, so be ready for fall prevention injury and syncope. The CDC's recommendation for pregnancy is to get the shot between 27 and 36 weeks of gestation. It is overwhelming to look at this one-page summary. Let's clean it up a bit. Now this looks much better. Let's take a global look at all this information and see what conclusions we can make. All live attenuated vaccines are contraindicated in pregnant and immunocompromised patients. The vaccines that are recommended in pregnancy are flu and Tdap. Oral vaccines are rotavirus and cholera. Both of these diseases cause GI issues, and the vaccines are administered directly into the GI system. The flu vaccines include egg, except for the recombinant flu vaccine, and all flu vaccines can cause Guillain-Barré syndrome. Other vaccines that include egg are MMR and varicella. Guillain-Barré syndrome appears throughout all types of the vaccines. Because it is so widespread, I have a suspicion that it is unlikely to be tested on the exam, except for the flu association. Everyone should know that. If the information is sort of gray, it's hard to ask questions. But with definitive knowledge, where things are more black and white, you betcha there will be questions. So, know all the contraindications with antibiotics, eggs, pregnancy, immunocompromised patients. Know that polysaccharide vaccines are ineffective in children and immunocompromised patients, and it's better to use conjugated forms of the vaccine. Another good way to test the vaccines is to present a case including signs and symptoms with the mention that the person is not up to date with their vaccines, then asking which vaccine preventable disease that person is experiencing. For that reason, I included the signs and symptoms of those diseases. Let's go back to the pre-lecture questions. How many of these can you answer now with confidence? Again, pause the video and write down the answers. And here is the CDC schedule for children and adolescents. And there you have it, the vaccines for NPLEX II exam. Happy studying!